I am not here tonight to sell a manifesto. I'm here tonight to invite you on a journey. It is a journey of creating a world-class healthcare sector. It is a journey towards good healthcare with dignity, where you are treated like and feel like Smaddy Picnic. It is a journey to reform healthcare because for too long we have been kicking the reform can down the road, and now we are at the end of that road. We are reforming healthcare to meet the needs of the people, not what looks good with optics and marketing. The people have suffered long enough. They have cried too often. Billions spent with lives not saved, but friends enriched. The People's National Party will not boast of the money that is spent. It will boast of the lives saved. And I am not just here because you can read the manifesto. I am going to say the team that is going to implement these policies care deeply about the health of the nation, led by a prime minister with medicine in his DNA. 3 generations of excellent doctors, with Sir John Golding planting the seeds that has allowed him to select a team that is going to go far beyond what Sir John himself did. I have been the doctor who decides who gets a bed and who gets to sit in a chair for days because there are no more beds. I have been the doctor who decides who gets oxygen because oxygen is low. I have been a part of the medical team that has decided who gets to go into ICU for that one available bed and who has to die. And that is not a responsibility that you would want to wish on your worst enemy, but it is a responsibility that is faced every day by our healthcare workers. You don't want to be those healthcare workers, and worse, you do not want to be that patient or relative. Billions wasted, millionaires created. Even as more mothers die during childbirth than 30 years ago, more babies are dying than 10 years ago, than 20 years ago. More Jamaicans now are suffering under this healthcare sector. And the tears of the grieving relatives for those who have passed demand change. It is not through infrastructural projects, not an ivory tower at the University Hospital of the West Indies, when so many clinics and hospitals lack staff and basic equipment to care for those who come to their doors. The needs of the patients and the staff need to be addressed, and not the needs of the politician. It cannot be that policies are guided by ribbon cutting over service. Nothing short of comprehensive reform of the entire healthcare sector is acceptable. The regional health authorities over 20 years now, we know that there is needed some level of reform, and we will make those painful reforms. We will change administrative functions. We will fix the wastage of money. We will drill down on the procurement issues that are facing the Ministry of Health. There will be a comprehensive review of how we fund the Ministry of Health and a comprehensive review of how we spend the dollars in the Ministry of Health. And above all, we will have care with dignity. And this means that you will have care with dignity from the womb to the tomb. The political will is here tonight, Jamaica. I feel it in the room. It can be done. It will be done. So I invite you, Jamaica, to journey with the PNP as we reduce waiting times for surgeries in A&E departments, in clinics, where we move patients out of chairs into beds, where we save mothers from dying in labor with improved antenatal care rather than blaming the mothers. We will end the lies that a dead baby a day at the Victoria Jubilee Hospital is due to prematurity by building a proper neonatal ICU at the Bustamante Hospital for Children, for ensuring that timely surgeries and interventions are done at Bustamante, the largest pediatric hospital in the English-speaking Caribbean, by having a proper CT scan and MRI for the first time, instead of having those children and babies carted over in the cold air to KPH. It is a pledge, it is a promise, it will be done. Join us on a journey towards improved emergency services with proper ambulances, where we will allow patriotic Jamaicans, families, businesses to adopt an ambulance and take care of the maintenance, so that ambulance will always be on the road and available in the case of an emergency. Join us as we improve radiology, where every parish hospital will have a CT scan, where we will improve dialysis so you don't have to cut the costs and allow yourself to be poisoned a little bit more rather than get the treatment you deserve if you have kidney failure. Join us on a journey towards dignity, where you no longer have to go on Facebook and beg for blood donations. Join us for a health service where we work towards seeing a grandmother with a hip fracture, getting her surgery done because the implants are there, rather than waiting 3 months to come up with the money to buy those implants. They will have their surgery and be home in 2 days. We are on a journey to create a primary care system, where if you can't afford to go to the clinics will come to you with home visits through community health aides, where you will be screened, and we will manage the diabetes better, we will manage the hypertension better, so that we will have less strokes, less amputations. Today, a leg was cut off. Every day, a leg is lost in Jamaica, likely due to diabetes, entirely preventative. Join us as we journey towards cancers screened and cured with less lives lost. And this part is particularly emotional for me because 3 years ago, my mother was diagnosed with colon cancer, and I've told this story before with her permission. And guilt-racked, I made a pact with God that should her cancer go and she'd not get that dreaded surgery where she would need the bag on her side permanently, I would do everything in my power, wherever I am planted, to improve cancer care in Jamaica. And yesterday, after her follow-up colonoscopy 3 years later, she continues to be cancer-free. Without any surgery, it disappeared from stage 3 to stage 0. And it reminds me that the pledge I made 3 years ago is not for her, but for those who could not afford the Tony Thwaites bill, who cannot afford the private doctor, those who can't call a friend and say, get a colonoscopy done. They have to wait 2 years. And during that time, the cancer grows where it is incurable. It is the reality that is facing a lot of Jamaicans, and one that I have vowed to help to put an end to that misery. And I am asking to join me on that journey, to join the People's National Party on that journey, to reduce the suffering of Jamaicans by providing the healthcare sector that I know we can create. We only have to dream it because the team is there to do it. A team that has over 400 years of cumulative experience, but they're just waiting for the right prime minister to focus on health. With the right economic conditions where we're not saddled by debt and austerity. I know, Jamaicans, that you are hurt, angry, and disappointed with the healthcare sector. But it is that same hurt, anger, and disappointment that gives us all hope. Because now you are demanding, for the first time since universal adult suffrage, that health be a priority in a general election.